Children's heart and brain surgeries are being delayed as pediatric hospitals across Ontario continue to overflow with kids needing critical care for respiratory illnesses. The province is now asking family doctors to stay open 7 days a week as the push to vaccinate continues.
Vaccination is something that has made a huge difference in COVID-19, and we know it is particularly valuable right now.
Toronto's top doctor made the trip to Ottawa to stand in solidarity with the federal Minister of Health and Ottawa's chief medical officer, all three calling on parents to get their kids caught up on flu and COVID vaccines.
We have safe and effective vaccines available to protect our children and to protect our entire communities and, of course, to protect our healthcare system.
In the first 3 weeks, the flu shot has been widely available. Toronto Public Health put needles in the arms of more than 20,000 people, but fewer than 800 of those were children under 5, the group most impacted right now by viral infections. While full data on flu shot uptake is not yet available, typically in Ontario, only about 30% roll up their sleeve.
We know that it has been a challenging fall thus far, and we're anticipating more challenge in respect of viral respiratory illnesses, notably RSV and influenza.
During a crowded school board meeting in Ottawa last night where a mask mandate was being debated, the chief of staff at the Children's Hospital of Eastern Ontario painted a grim picture, saying to make more room for the wave of sick children, they've had no choice but to cancel many procedures, including brain and heart surgeries.
Many kids had already waited way too long for those appointments, and now the wait has been prolonged even more. None of this is okay for our kids and their families.
Dr. Lindy Sampson also says some kids are waiting 13 hours to see a doctor, and others who need critical care are waiting days for an ICU bed.
Never in the 25 years that I've been at CHEO has this many patients required intensive care for viral-related breathing difficulties or admission to hospital to manage their viral infections at a single given point in time.
Today, Ontario's health minister was grilled on this during question period.
It is obviously deeply disturbing for all of us to hear stories about parents who have to wait with their children as they get admitted, as they are waiting for that bed to open up in the hospitals. But I also think it's important for us to understand and appreciate that these are not new issues and not new problems. We were left, frankly, with a health system that was in dire need of investments. Our government has made those investments.
Now, to help ease the pressure on the pediatric hospitals, the Ministry of Health sent a memo to family doctors asking them to stay open 7 days a week and to provide evening availability until further notice. We are learning that that memo is a request and not a directive, but the purpose is to hopefully give parents with sick children more options.